Hi, Amy Stein from Beyond Basics Physical Therapy here doing a video series with Caroline Ball, which has been amazing, and please tune in to future videos as well as the past videos on her healing journey and what she went through as a patient with pelvic pain. And we are also doing a giveaway of my book, Heal Pelvic Pain, and my video, Healing Pelvic and Abdominal Pain. If you share any of the videos, you will be eligible to win a prize. And because our goal is not to give out prizes, but more to spread awareness into the community as well as to patients and give them a sense of hope. Caroline is a perfect example of someone that went through a very long journey, but she's doing really well now. And today we would like to talk about what she did at home, like what seemed to work for her, because everyone's different and everyone's journey is different and everyone's healing process is different. So for what works for one person may not particularly work for another. So it would be really great to hear what you did at home, what seemed to work, maybe some things that didn't seem to work, as well as when you had flares, like what exactly you would do.
Definitely. I think, one of the things to start that was really helpful for me is having a great relationship with Amy and different doctors I was working with. So anytime, something wasn't working at home, I could email them or ask a quick question that would help me modify quickly what was going on versus I have some friends who have had pain and continue doing something for a while that then just exacerbates an issue. But I think for me, one of the things that helped a lot was at Beyond Basics getting guidance on, the right exercise, right diet, right home program. So then when I was doing it, I kind of almost had direction and in a way homework to be doing. And I think what was really helpful for me was low impact exercise. So elliptical, walking on an incline on a treadmill, and staying away from classes like Barry's boot camp that I used to love, and like bar classes, and almost putting those on hold. And now I'm able to do those types of classes again now that I'm stronger and have healed. But those I found really exacerbated my symptoms. So for instance, if I did like a Barry's or a bar class, I would be, my abs would be so sore, my hips would be sore, and then I would come into PT and they'd be like, what happened? All of a sudden my hip flexors are so sore again, and I'd had progress and it almost would kind of just stunt some of the progress I was having. So I think in terms of a home program, in terms of exercise, again, the elliptical, walking on an incline, and then just trying to get, even if it's just 30 minutes a day, just regularly having consistency of doing that. And then, some of the exercises I did at home, Amy worked with me on, ab work and, lower impact curl ups I could be doing at home. And then some exercises I did on my stomach to kind of help mobilize, if I was having indigestion or different issues that I could do at home. So stomach massages I would work on my own, and I got a foam roller at home. So that helped a lot, just, even 5 minutes every day, kind of working out my hip flexors, because that was an area I learned where my hips were tight would then actually in turn impact my pelvic floor area and my stomach. So and then one of the things Amy and I have talked about a lot, but is difficult I think when you're experiencing pelvic pain and go on the journey of seeing so many different doctors, and there's so many things to work on at once. And so for me, I really focused on seeing the right doctor, seeing the right physical therapist, and exercise. And for me, it was too hard to also be like, okay, now I'm going to limit myself to just this diet. And I think that's okay. I think for me, and my advice, I guess, would be figuring out what in your control you can do, and then not being too hard on yourself if you can't do everything, because I feel like when I almost tried to do everything, then I wasn't doing anything fully.
Yeah, because it can be overwhelming for patients when we say oh, you need to change your diet and you need to drink more water. And I know one of the things that you had mentioned was magnesium helped you. Obviously you should consult with your physician or healthcare provider, but that was something that helped.
Yeah.
And Yeah, and everyone's different. So some patients don't respond that well to walking on an incline, but for you, it was okay. And then I do want to add, like with strengthening exercises, we started pretty slow because doing too much would irritate the tissue and the trigger points. So we started very slow with the exercise and strengthening, which is something you need to do. But typically what we find initially is that it can actually exacerbate some of your symptoms. So it was a journey, but we got there.
Yes.
And it's so exciting to hear you're back to these exercise programs.
Definitely.
That's awesome. Is there anything else you want to add that you did?
I guess the only thing maybe I would add is post my surgery. I think in my mind I was like, okay, I've now had my surgery. I've been doing physical therapy. I'm ready to like get back and go to Barry's. And I think I would say like, especially when you've been doing low impact stuff, and after my surgery they recommended not working out at all for a little while because they didn't want to flare things up. So when you've kind of lost strength in a lot of ways, then going to do a extreme workout is not a good idea. And so I think in my mind I was like, okay, now I've done all these things, I'm ready to go back. And something I did was I invested in a personal trainer for working out, which really helped. I think after having done physical therapy, gotten stronger, had my surgery, done the post physical therapy, by the time I kind of gone through all of that, it still wasn't like I was ready to like go back out to my normal workout routine. And so I think investing in a personal trainer was really helpful to me, because with someone who's kind of watching you and making sure things aren't flaring, they kind of can tell, okay, we can push you in this way but not too much, was really helpful, I think, to then the last step in regaining my strength.
Right. I agree. We actually offer here in our Midtown location, we have a Pilates rehab instructor, and then in our downtown location we have a fitness trainer that works specifically with women's health and orthopedic conditions that patients experience, and the goal is to do a couple sessions and then the patient at some point can go back to trying like a boot camp or something, but we like to try guide the patients so that they don't flare their symptoms.
Yes, so important.
Yeah. So thank you for that. I'm hoping that was helpful. Again, my book and DVD actually go through a home series of deep breathing exercises, massages, stretches that you could do at home. So both are very helpful. And then obviously it does not replace pelvic floor physical therapy by any means, but we highly recommend doing a home program during your physical therapy and after the physical therapy to continue it at home. So please share these video series and be eligible to win a book or a video. And one more reminder that we do have our Pelvic Health 101 free classes that we offer. It's a series of classes that we offer in the fall, spring of each year. So please come attend. It's on Eventbrite on our website as well, Beyond Basics Physical Therapy. And our social media, again, is at Beyond Basics PT. Thank you so much, and thank you, Caroline.
Thank you.